Hi, welcome to Endless Nurses World. I hope all are fine. In last video, we talk about some questions. In this video, we'll study about psychiatric nursing related questions. Before that, we should know about some theories of personality. So, according to the Freud, the ego, superego, these three powers will determine the human personality. So, the Freud said that psychodynamic theories are first oral stage, that is birth to 1 year, then anal stage 1 to 3 years, phallic stage 3 to 5 years, latency stage 6 to 12 years, and genital stage 12 years and beyond. So, this is psychodynamic theory, Freud. In psychosocial theory, according to Erikson, first is trust versus mistrust, birth to 1 year. Then autonomy versus shame and doubt, that is 1 to 3 years. Initiative versus guilt, 3 to 6 years. Industry versus inferiority, 6 to 12 years. Identity versus role confusion, puberty to young adulthood. Intimacy versus isolation, that is young adulthood. Generativity versus stagnation, middle adulthood. Integrity versus despair in late life. This is about psychosocial theory. Piaget will describe about cognitive development theory, that is sensory motor stage from infancy to toddler. Then pre-operational thought stage is preschool. Pre-operational thought stage continues and school age also. Then fourth one is concrete operational thought stage, that is pre-adolescent. Then formal operational stage is adolescent. This is about Piaget cognitive development theory. Now coming to the questions. First question is, what age does Freud's phallic stage of psychosexual development compare with Erikson's psychosocial phase of initiative versus guilt? The options are adolescence 6 to 12 years, 3 to 5.5 years, birth to 1 year. The answer is 3 to 5.5 years. Next question is, which relationship is of most concern to the nurse because of its importance in the formation of the personality? The options are peer, sibling, spousal, parent-child. Then answer is parent-child relationship. The next question is, a nurse concludes that a client is using displacement. Which behavior has the nurse identified? The options are ignoring unpleasant aspects of reality, then resisting any demands made by others. The third option is using imaginative activity to escape reality. Then fourth is directing pent up emotions to other than the primary. Then answer is directing pent up emotions to other than the primary. The next question is, in the process of development, the individual strives to maintain, protect and enhance the integrity of the self. The nurse determines that this usually is accomplished through the use of, the options are affective reactions, withdrawal patterns, ritualistic behaviors, defense mechanism. The answer is defense mechanisms. The next question is, a client diagnosed with major depression tells a nurse, no matter what I do, everything turns out bad. The nurse concludes that this is an example of, the option is using a cognitive distortion, seeking sympathy from the nurse, regressing to an earlier developmental level, avoiding responsibility for previous behavior. The answer is using a cognitive distortion. The next question is, a male college student who is smaller than average and unable to participate in sports becomes the life of the party and stylish dresser. What defense mechanism should the nurse determine that the client is using? Option is introjections, sublimation, compensation, reaction formation. Then answer is compensation. The next question is, a staff member tells a nurse that an older client gets irritable when asked to assist with activities of daily living. On what general information about older adults should the nurse base a response? The options are decreased ability to cope, loss of ability to cooperate, ambivalence toward authority, difficulty performing step procedures. The answer is decreased ability to cope. The next question is, the parents of a toddler who was recently diagnosed with moderate retardation discuss their child's future independent functioning. What should the nurse conclude? The options are, they accept the child's diagnosis, denial is being used as a defense, they want to explore their child's limitations. Then fourth one is intellectualization helps them put the diagnosis into perspective. The answer is, the denial is being used as a defense. Next question is, on which generally accepted concept of personality development should a nurse base care? Options are, by 2 years of age the personality is firmly set. The personality is capable of modification throughout life. The third one is, the capacity for personality change decreases rapidly after adolescence. Then fourth one is, by the end of the first 6 years of life, the personality has reached its adult parameters. The answer is, the personality is capable of modification throughout life. The next question is, a 6-year-old child is diagnosed with type 1 diabetes. Considering the child's cognitive developmental level, which explanation of the illness is most appropriate? The options is, diabetes is caused by not having any insulin in your body. Second one is, diabetes will require you to take insulin shots for the rest of your life. Third one is, you will be taught how to give yourself insulin now that you have diabetes. Then fourth one is, taking insulin for your diabetes is like getting new batteries for your superhero toys. The answer is, taking insulin for your diabetes is like getting new batteries for your superhero toys. The next question is, which individual is coping with issues concerning dependence versus independence? The options are infant, toddler, school age child, preschool age child. The answer is toddler. The next question is, a 17-year-old teenager is diagnosed with leukemia. Which statements by the teenager reflect Piaget's cognitive processes associated with adolescence? Select all that apply. First one is, option is, my smoking pot probably caused the leukemia. Second one is, I am going to do my best to fight this terrible disease. Now third one is, now I can't go to the prom because I have the stupid illness. Fourth one is, I know I got sick because I have been causing a lot of problems at home. Next option is, this illness is serious, but with treatment I think I will have a chance to get better. The options are, I am going to do my best to fight this terrible disease. Now I can't go to the prom because I have this stupid illness. This illness is serious, but with treatment I think I will have a chance to get better. Next question is, a person mowing the lawn is badly disfigured by the lawn mower blade. According to Erikson's theory, which age will demonstrate the greatest risk of longer term psychological effects? The options are 11-year-old, 35-year-old, 55-year-old, 70-year-old? The answer is 11-year-old. The next question is, a nurse must consider a child's cognitive level of development when providing preoperative teaching. At which stage of Piaget cognitive theory should the nurse anticipate a child will experience the greatest fear of surgery? The options are sensory motor, pre-operational, formal operational, concrete operational. The answer is pre-operational. The next question is, a nurse greets a client who had been experiencing delusions of persecution and auditory hallucinations by saying, "Good evening, how are you?" The client, who has been referring to himself as man, answers, "The man is bad." Of what is this an example? The options are dissociation, transference, displacement, identification. The answer is dissociation. Next question is, a client with the diagnosis of borderline personality disorder has negative feelings toward the other clients and the unit and considers them all to be bad. Which defense was the client using when this statement was made? The options are splitting, ambivalence, passive aggression, reaction formation. The answer is splitting. Next question is, in response to a question posed during a group meeting, the nurse explains that the superego is the part of the self that says, options are, "I like what I want," I want what I want. Third one is, "I should not want that." Fourth one is, "I can wait for what I want." The answer is, "I should not want that." Next question is, incidents of child molestation often are revealed years later when the victim is an adult. Which defense mechanism reflects this situation? Options are isolation, repression, regression, introjection. Answer is repression. Next question is, a client with the diabetes mellitus is able to discuss in detail the diabetic metabolic process while eating a piece of chocolate cake. What defense mechanism does the nurse identify when evaluating this behavior? Options are projection, dissociation, displacement, intellectualization. The answer is intellectualization. Next question is, an older adult tells the nurse, "I regret many of the choices I have made during my life." Which of Erikson's developmental conflicts does the nurse identify that the client has probably failed to accomplish? Options are ego integrity versus despair, identity versus role confusion, generativity versus stagnation, autonomy versus shame and doubt. The answer is ego integrity versus despair. These are all about some of the psychological questions. If you like this channel, you can subscribe to me and ring the bell button. You will receive my notifications. Thank you.